Hello, everyone. Today, Jahaira, Perlita, Elizabeth, and Diana are going to talk about the periodontal ligaments, the alveolar bone, and the orthodontic treatment. Are you concerned about the crowding of your teeth and are considering getting braces? Have you ever wondered what is the process of the orthodontic treatment? Orthodontic treatment consists of tooth movements that can help you achieve the beautiful and straight smile of your dreams. Before we continue, we're going to review the anatomy of the tooth. And we're going to start with the enamel, the dentin, the pulp cavity, the nerve supply, the cementum, the periodontal ligaments and the root canals, the alveolar bone, and the gingival tissue. So what is the role of the periodontal ligaments and the alveolar bone in the orthodontic treatment? So we're going to start by giving you the definition. Periodontal ligament is a connective tissue that attaches to the alveolar process and a layer called cementum, which covers the root of the tooth. And the alveolar process is a part of the maxilla or the mandible that supports and holds the teeth in place. Therefore, orthodontic treatment depends on remodeling of the PDL and the alveolar bone. And next, we're going to talk about the histology of the periodontal ligaments and the alveolar bone.
So the principal fibers of the PDL. The PDL fibers work like rubber bands between two hard objects, which in this case would be the tooth and the alveolar bone. They protect the soft tissues by distributing any forces placed onto the teeth when eating or even during speech. There are three principal fiber groups of the PDL, which are the interdental ligament group, the gingival fiber groups, and with the primary principal fiber group being the alveolodental ligament. The alveolodental fiber subgroups. The alveolodental ligament group consists of 5 various fiber subgroups, which are the alveolar crest group, horizontal group, the oblique group, apical group, and the interradicular group. Each group has a function, and each function is related to the differing orientation to the tooth. Each group's function is to resist rotational forces and additional functions pertaining to each group's function.
What cells are in the periodontal ligament? The PDL is a multifunctional unit of connective tissues that contains numerous cells: fibroblasts, epithelial cells, osteoblasts, cementoblasts, and mesenchymal stem cells.
What about the forces that affect the PDL and the alveolar bone? There are 3 main forces in orthodontic tooth movement. Optimum force, which will play a role in tension and pressure that will affect the PDL. The sufficient time, and this will play a role in the ortho treatment time. And the bone remodeling that will play a role and affect to the alveolar bone. And what about the alveolar bone during these forces? Well, tension to the PDL will increase vascularity on site and introduce the repopulation of the ability for bone cells such as fibroblasts and osteoblasts, which will then influence the formation of bone. There will also be pressure on the other end to the PDL, where vascularity will also increase on site and introduce cells such as fibroblasts and osteoclasts, which will be the loss of bone.
Lastly, we will talk about orthodontic tooth movement. Orthodontic tooth movement is typically divided into 3 phases by clinical observation. First, the initial phase occurs 24 to 48 hours after forced application. The lag phase lasts multiple days with little tooth movement. And lastly, the post-lag phase is when clinically noticeable tooth movement is observed. These are our references. Thank you for listening.